Good evening. I see you're for cranial nerve exam. Is that correct? Brilliant. Can I get your name and date of birth, please? And now, has there been any changes in your medical history? Any new medication? All right. And just remind me, who's your family doctor again? Okay. And now, within the past 14 days, have you traveled outside the country, come down for a cough, a sickness, fever? All right. Well, we will just begin with a few vital checks. Are you currently taking any medication for blood pressure, for your heart? I see. And now, do you have any asthma, any breathing difficulties? Okay. To begin with, I will be taking your blood pressure just to get a general reading on it. After that, I will be checking your heart and lungs just to ensure that they are beating and breathing properly. All right. Please lift up the sleeve on your right arm. Thank you. Now you will feel some minor pressure when this does go on you. It should not be painful, just a little bit of squeezing. I'll get you to hold still for me. Here we go. Keep your arm relaxed, don't tense it, don't try to squeeze it. Brilliant. Now just while that is reading on the machine, I'll get you to lift your shirt up for me, please. I'm just going to listen to your heartbeat. So please breathe like normal. Don't take a deep breath in. Just keep it as you normally would. Very good. And now, when was the last time you had a cranial nerve exam? All right. See on the other side. Perfect. I'll grab that sleeve off of you. Now, just for your lungs, get you to lift your shirt all the way up for me. Now, take a deep breath in. 1, 2, 3. And release. Deep breath in. 1, 2, 3. And release. One more time. Take a deep breath in for me. 1, 2, 3. And release. Does seem like your overall lungs and heart are quite healthy. Have you had any pre-existing conditions at all? All right. Now for our first test, we'll be doing an eye exam. Here I have an eye chart. Together we will go down this list, ensuring that you're able to see the adequate amount. If not, we'll see how far you're able to make it. Perfect. Now starting at the top, what letter is this? T, correct. Z, very good. Perfect. P, T, O, C. Correct. Z, L, P, E, D. Correct. E, T, O, D, C, F. Getting a little bit trickier now. So the correct way was D, P, C, Z, L, F, T. Now if you get the bottom three, that'll be quite lovely. Yes, that was C, F, D, T, E, O, P, L. Perfect. Now for the last one, we'll see if you get the bottom one. So the correct way was LDCZOTEP. Now for the very bottom one. Yes. So we have PFCDTZLE. Now overall, you didn't do terrible. Let's see, it's on file. Is that an improvement? Let's see. I'll log that down. All right. Now for an Excel test, I have this measuring tape. This is mainly just to check if you're able to see the numbers a little bit further away. Very similar to the test that we just did, just a little bit of a double check. Let's see. So I'll be showing you numbers along this line. Please tell me what is the closest number you're able to see and what is the furthest number you're able to see. Perfect. All right. What is the closest number you're able to see? Okay. What is the furthest number you're able to see? Okay. What is the closest number you can see? Perfect. What is the closest number you're able to see? All right. What is the furthest number you're able to see? All right. We'll move on from that one. The next we will do a little bit of a color test. This is to ensure that the overall vision of your eyes are able to adequately use the cones and rods of your eyes and vision to depict what color you're seeing. So I will be pointing at a color. Please tell me what color is it or what you see. You don't have to be too picky of saying dark green, light green. Just say what shade it falls in. Okay, let's see. What color is this? All right. What color is this? What color is this? What color is this? Okay. Lastly, what color is this? Okay. Nothing too far off. It should be all right for that. There we go. Now I'm taking a look at your actual eye itself just to see the overall structure of it. So I would like you to hold and stay very still for me. Just look straight ahead. You can look at my nose. You can look off at the wall behind me. Just keep your eyes focused on one object and try to stay as steady as possible. Let's see here. Take a little bit look at your eye here. There is some minor redness near sclera. Nothing too out of the realm. You do seem to have it on both eyes. Just from the given information, take it that you're up quite late, either on your phone, playing games, doing work, maybe reading. Difficulty sleeping. All right. Now I'm going to be focusing on your pupil dilation. I will be covering one eye, just so we focus on the one eye at the time. To begin with, I will cover your left eye. I will be then moving this light just up and down to see the overall contraction and constriction of your pupil. All right, hold still for me. Just look straight ahead, ignore the light. Now for the other eye. Just focus straight ahead, ignore the light. A little closer here. Perfect. Now for our last little eye test, I would like you just to watch my fingers, okay? I want you to tell me when they leave your peripheral vision and when they re-enter your peripheral vision. Perfect. So look straight ahead at me. Just focus on my face, ignore everything else. Now in the corner eye, tell me when it leaves your peripheral vision. Good. And then it re-enters like that. Perfect. Now we'll do that one more time. Perfect. Similarly, we will use for the vertical aspect. So I will have my hands straight like this and we'll go up and down. Just focus on my hands, not my arms and whatnot. Perfect. So again, look straight at my face. Perfect. Now we'll be moving on to the next little aspect, which is a hearing test. To begin with, I would like to take a look at your ears, just to make sure that they are healthy overall. In here, I will quickly just look at the outer ear. The pila looks quite healthy. No noticeable damage. We can use this Q-tip just to wipe, feel around your outer ear here. How often do you clean your ears? Now, do you tend to use a Q-tip? Do you tend to use a cleaning tool? I see. All right. Well, I'd like you to hold very still for me. I'm going to look on the inside. They don't seem irritated, don't seem too red. There's a little bit of an earwax buildup, which may affect the overall hearing just a little bit. When there is too much earwax inside of the ear, it will cause a bit of a delay for the sound waves to go in, which in turn will make it a little bit more muffled when you're hearing. Perfect. We'll now look at the middle of the ear. This is where the three bones are, the occipitals. This is used to amplify the vibrations that we do hear just from the sound waves and make sure we can then send it into the cochlea. So for this, I'm going to do a very subtle test. I'll be whispering different words on either side of your ears. I would just like to hear if you're able to understand what I'm saying. All right, so please cover your eyes for me. Just keep your eyes closed, fully closed. Thank you. Once again, please tell me what you hear me whispering to you. Chocolate, chocolate, chocolate. Very good. Lilies, lilies, lilies. Okay. Lavender, lavender, lavender. Bananas, bananas, bananas. Sunflower, sunflower, sunflower. Very good. You can open your eyes again for me. Perfect. You did quite well on that exam, so I do believe it is able to work properly. Now for the inner ear, we have the cochlea. The cochlea will take these sound waves and then turn it into electrical impulses, which is sent up to the brain, so we are able to comprehend what we're hearing, whether it's someone talking, you're hearing a sound, and whatnot. All right, for this test, we want to mainly look at the delay. So I will snap my fingers a different amount of times around your ears. I would like you to tell me how many times you're hearing me snap. Very good. I'll get you to close your eyes one more time for me. Just keep them closed. Very good. So tell me how many times you hear me snap on either side of your ears, okay? Very good. Perfect. Okay. I'll get you to open your eyes up for me one more time. And now during any of that, was there any pain, any ringing sounds? Perfect. Add that to your file. Seem to have no issue with the overall hearing. Perfect. We'll now be moving on to your sense of touch. Here we're mainly ensuring that you're able to feel the pressure of us pushing down on you and the overall muscles of your face, of your body, and whatnot. It works similarly kind of with the ears. The ears have a lot to do with the balance as well. However, we'll be mainly focusing on the balance as well as the touch for this aspect. Very good. I'm just going to feel around your face. I'm just feeling for any lymph nodes. Typically speaking, when you have quite a few lymph nodes, that means you're battling an infection, a sickness possibly, or they can even disappear for no reason. However, we want to just feel around your neck, just to make sure that you don't have any. This does tend to be one of the most common spots, just around your neck, behind your ears right here. Okay. I'm going to feel down by your collarbone a little bit onto your arms, okay? Perfect. Now, have you felt any tension, any unexplained pains in your body? Could be like a muscle pain, back pain. Yeah. There we go. Doesn't seem to have any major concerns for the lymph nodes, and your body overall feels quite normal. To begin with, we're focusing on the face, so I would like you to raise your eyebrows as much as you can. I will be very gently pushing down on your eyebrows. I just want to see if you're able to resist and keep me from pushing your eyebrows down. Very good. Now, in the opposite sense, keep your eyebrows down, frown, and try pushing them up. Perfect. Now make a big smile for me. Very good. Keep your smile. I'm going to feel your under cheeks here. While doing this, we tend to look for any issues in the muscle itself, lack of hardness, lack of ensuring that the muscles are healthy. It could possibly mean to a decay of muscles. It could be just dissolving, or there's a possible issue with the membranes of it. There we go. All right. And now give me a big frown. Make sure you're rounding your eyebrows, rounding your face. Very good. Just feel it by your mouth right here. Perfect. Now moving on a little bit to the balance test, I want you to put your arms straight out. Keep them straight, keep them very horizontal. I'll be trying to push them up. Make sure I cannot do that. It's very similar to what I was doing with your eyebrows. Perfect. Keep them steady. Don't let me push them up. Perfect. And now in the opposite way, do not let me push them down. Keep your arms up. Do not let me push them down. Perfect. Now please put your hands straight out like this. I would like to feel the joints of your hands. Just check for any arthritis, any issues with your joints here. Let's see. Does it hurt when I bend them at all? Okay. I'm just going to try cracking your knuckles right here. Just bear with me. Perfect. Now for the other hand. Do you use a computer quite often? Lots of typing? Many studies have shown that using a computer, if you're in the office for work or whatnot, can lead to early and onset arthritis. It just tends to occur by the way the hand is and the placement of it. Very good. And put your arms down for me. Does seem like overall balance and muscle retention is fine. Perfect. Now we will be moving on to the sense of smell and taste. Alright, for the sense of smell, we have a multitude of different vials that I will be getting you to smell. In here, they all look the same. There's no sign of what it is, any labels or whatnot. However, we have all the names written down. So please tell me what it smells like to you. Take a deep breath in. Very good. And what does that smell like to you? Like honey? Very good. Let's see. We'll do 4 more of these. Just get a general idea of ensuring the accuracy of your sense of smell. So for this one, it is a little bit of a fainter scent. So you take your time and trying to figure out what it is. And what do you think that is? Not too far off. Unfortunately, you are incorrect though. It is a mix between lavender and a lemon smell. Not too far off though. Let's see here. Last 2. What do you think that is? Brown sugar, very good, yes. Here we go for the last one. A little off for that one. That was a apple cinnamon. Yes. Doesn't seem too bad. However, we will note that you're not the most accurate. Let's see here. Patient seems to have most of the scents correct. Just a few outliers. Okay. Now for the taste, I will first take a look at your mouth, just ensuring that the overall oral hygiene is quite good. Take your mouth and please open it wide for me. Keep your mouth open. I'm just going to take a look at your gums down here. Just looking for any major recession, any overall health. The gums do tend to show a lot of the health of the body itself. Any disease or growth on it can tell the not all of it, but a good portion of health for the rest of the body. And when was the last time you visited a dentist? Okay. I'm gonna hold your tongue down and just say ah. Now I'm just gonna hold your tongue down and just keep speaking. Just talk about your day. I'm just looking at the back of your throat of how it's working. Just want to ensure that there is no irritation. It's a little difficult to pronounce everything correctly now, isn't it? Very good. Have you had a sore throat recently? Had anything sharp? Maybe spicy recently? Okay. I just see a minor irritation in the back of the throat, mainly just more redness, possible scratchiness. I do recommend, just to help fix that up and help you heal a little bit faster, for having some tea, a green tea, a lemon tea, a honey tea. Just help kind of coat and soothe the throat for you. Perfect. Let's see here. Now for this next test, we'll be mainly looking at your brain and how fast and how accurate your brain is working. For this, we'll be doing a little bit of a memory test. This is focusing more on the prefrontal cortex and the short-term memory. This will allow us just to get a general idea of if your memory is average, above average, below average, and whatnot. So I will be showing you different cards. It could be the Queen of Spades, it could be Queen of Hearts, it could be a Jack of Diamonds, any of the such. And I want you to remember what suit it is, and the card itself, the value of it, and the number I'm showing it to you. So for example, King of Spades, 4 of Clubs, 10 of Hearts, and 6 of Spades. Now, what was the highest valued card in that 4-card pull? Very good. Yes, that was the King of Spades at the very beginning. So I'll be asking you questions like that. Asking you the suit number, maybe what was the highest, what's the lowest card, and whatnot. Perfect. Let's see here. Seven of Hearts, King of Hearts, 4 of Hearts, 10 of Spades, and 8 of Diamonds. Now, what was the second card I showed you? Very good, that was the King of Spades. Very good, that was the King of Hearts. Perfect. Let's do this a few more times. 7 of Diamonds, 3 of Clubs, 4 of Diamonds, 'King of Diamonds, Ace of Spades, sorry, Ace of Clubs, my apologies, 7 of Clubs, and 10 of Diamonds. Now, what was the lowest value? Very good, the 3. And what was the suit? Was it a diamond? Was it a club? Was it a spade? Perfect. Yes, that was the 3 of Clubs. And now just for the last one. Three of Diamonds, 2 of Clubs, 2 of Hearts, 2 of Spade, Queen of Heart, Jack of Diamond. What was the third card I showed you? Yes, very good. That was the 2 of Hearts. Now, during that little test, was there any difficulty, any issues with your overall memory? Did you question yourself, second guess yourself? Now, we did track the overall accuracy of your responses just to ensure that we have it on record. Ideally, we'll do this test a few more times when you come in next, and then we can kind of look back and forth between the initial and how it is progressing over time to see if you're having an active decrease in your overall memory. However, right now you did have some adequate responses, so I'm not too worried about your overall memory and how it's working. Now, in regards to the hippocampus, this is where we have the long-term memories and where they're typically stored. In contrast to the previous test, which is focusing on the prefrontal cortex or the short-term memory, the hippocampus is more of maybe in your childhood, memories that you had growing up, memories that have been around for a while. So for this test, although I can't just give you a number to remember, I'll be asking you questions that you initially filled out on the form for me previously. You did this when we were booking with me, so I'll be asking you questions of your childhood. Just answer yes or no, or if it applies. Okay. Did you have a dog growing up? Very good. How old were you in the 3rd grade? I see. Did you learn to ride a bike? Okay. What year did you graduate high school? Okay. Do you like cats or dogs more? And did you have any fishes growing up? Any hamsters? Any pets like that? Does seem like your answers are matching up with what we did ask you previously. Perfect. So just given that, I don't believe there is any major concerns with your short-term or long-term memory. However, of course, we will have to do this test a few more times just in the next coming appointments to see the overall increase or decrease of your memory, specifically the short-term memory. However, besides that, it does seem like your health is quite healthy and you're quite good. Overall, your eyes seem quite good. Recommend just ensuring that you have 1 to 2 hours of no screen time before you go to bed. Your hearing was quite adequate. Same with your sense of smell, sense of taste. Overall, the feelings that you had in your body, for your face, for your arms, when I was just touching and moving your face, was quite acceptable as well. Brilliant. Well, if you have any further questions, feel free to ask. If not, I recommend seeing and booking another appointment just for next month, or we can do up to 2 months if you prefer, just so we have a general timeline to get a stable report on your memory. It's something that not everyone thinks about right away, but it is an important thing to take account of. Lovely. Well, you can head out, and the receptionist at the front will be able to book you in for your next appointment. Perfect. If you notice any other worries or concerns, feel free to give us a call back, and we'll be more than happy to answer you or fit you in for a sooner appointment. Lovely. I hope you have a fantastic night, and I can't wait to see you at our next appointment. Bye-bye now.